Today, we're going to talk to Dr. Kurt Hoffman, an orthodontist and the co-founder and chief medical officer at Lineflow. And we're going to talk to him about teledentistry and also about his software that is called Lineflow. And really, it's one of those things that I thought was pretty interesting. I didn't really know what teledentistry was, and so I started talking with him. And it's a little bit. I originally thought teledentistry was just a a video call with patients, and I really didn't. I was like, okay, that kind of makes sense, yeah, I could see, especially during the pandemic. And then the more I learned about Lineflow, I realized that there's multiple levels of teledentistry, and Lineflow uses all of them, or nearly all of them, I feel like. So Kurt, thanks for coming on the podcast. I appreciate it. So tell me a little bit about Lineflow and kind of how you got involved in teledentistry.
Sure. Well, first of all, thanks for having me. I really appreciate it. We started developing the software, a friend of mine who had been in the virtual medical, physical therapy, veterinary space. And he happened to be father of one of my son's friends. And we were having dinner with our sons and just started talking about it. And I said, wow, this would be an awesome application for dentistry. And when we started working on it, there was nothing out there. Dental monitoring was being developed as a product at the same time we were, and they beat us to market by several months. And we launched Lineflow in December of 2019. And it's a platform that is used to monitor tooth movement remotely, is probably where it's most robust. But you're right, it does have a lot of other features that you'd expect from teledentistry, like virtual consultations, video, instant messaging features, and then even some lead generation features that we have. And then most of the power is in actually tracking tooth movement and the actual orthodontic treatment as it progresses, and mainly with digitally treatment planned cases, whether that's with aligner treatment, which it works for all aligners and all aligner companies, or a product like Brius, or anything where you've designed the setup digitally and want to set that in progress and then monitor it. That's where it's got the biggest bang for your buck.
I gotcha. So yeah, because it's one of those things when I was learning about it, it kind of turns your patient workflow into almost a better experience, from what I could tell, than you could really have without software, which is kind of something that I think people don't really think about with teledentistry. I think, you almost think about just the communication aspect. And what I was kind of looking through is that when I was kind of reading and learning and, really going through your app, is it allows the patient to kind of say how often they're wearing the aligners, and then if they're kind of happy with the progress and they're happy with how they feel about it. And which is something that, for me, it makes a lot of sense in the technology. I mean, technology wise, because it's like, okay, now you're learning more about your patient and how they're feeling. And you can if they're not happy and something in their mind, they're not happy, even though you look at the treatment, you're like, oh, it's going great. This patient should be, feeling really good about themselves. You can almost intervene and say like, hey, your treatment's going great. Why are you not happy? And almost kind of stop a problem before it really occurs, on a mass scale, versus just kind of waiting for the problem to hit your doorstep of this patient, leave a Google review, after everything's said and done, saying, hey, I'm not happy. And you're just like, what? Everything went great,
Yeah. Even if they don't leave a Google review, right, or whatever, I've found it's a patient will have a question about how their treatment is going. Or I remember one message that came through, a mom called and asked about, or instant message through the app, how things were going, because her neighbor had kind of scared her. She'd had a bad experience with at-home aligners, and her bite didn't feel right. And she just wanted to make sure that that was not happening to her.
Oh.
And traditionally, before this, teledentistry or a Lineflow, that patient maybe would have worried about it all weekend. And then maybe by the time Monday got around, they would have called the office. And then, I would have gotten a message, or our clinical supervisor would have gotten a message and then passed it on to me. And then there's a phone call. And so it just created, it eliminated all that work. She just sent a simple message through, I'm concerned about my bite after what my neighbor said. How's it looking? Boom. 10 minutes later, everything's cool and we're off and running. And there's no follow-up work. It's all the messages are stored on the cloud and can be accessed by the patient and the clinic to monitor everything. Another thing that you said at the start of your last statement, that I totally agree with, it was counterintuitive. When I was developing a Lineflow and how it would work, we were trying to do something that was at least as good as the in-office experience, because we didn't want to take away from anything that would affect quality or patient experience or anything like that. And after using it, what was weird is, you're right, it is a better patient experience on many levels, and the monitoring is much tighter, because many orthodontists are seeing their patients every 6, 8, 12 weeks with aligners, in office. Well, with a Lineflow, you're getting images and feedback from the patients much more frequently, and you're getting pictures of the aligners and the teeth and the occlusion at each aligner change, which are uploaded and stored on the cloud and can be viewed on a grid, so you can actually see the tooth movement. And the patient has the same feature, so it's motivating them. They can see that their teeth are moving, and so that is the thing that's been most surprising. Is, I think, for aligner patients or digitally programmed treatment, it's more effective than a traditional 6-week in-office visit.
Yeah. And it's one of those things, whenever I maybe go to conferences or something like that, they're like, you need to take pictures of your patients. And I'm not talking about for aligners. I'm just talking about in general dentistry.
Right.
You need to do this. You need to do this. And the problem always arises from either the dentist or the assistant or whoever just doesn't take the photos. You know what I mean? You get so used to your own workflow, or maybe like the assistant just gets lazy that day, and then you don't tell that assistant, hey, you need to take the photo. And you kind of, it veers off the path of what should be done. But because, teledentistry, this is kind of the way you're communicating. This is the workflow. Like that patient is taking the photos. You have that at every visit. You have that between the visits, and you're really creating a new way that I would say is going to change the expectations of patients in the future. And this is something that I kind of compared it to, because you actually have an app for either iPad or iPhone that is for the patient as well as for the dentist. And from my understanding is you can actually white label the app for the patient. Is that correct?
Yes.
Yeah.
That's been our most popular. There's a small setup fee for that, but that way the app in the App Store, for example, my app would be Hoffman Orthodontics, and it would have my logo on it. And the patient would download that, and then every time they open it on their phone or get a message, it's got my logo and name, and it looks and appears just like my app. So it adds real value to your office. And so I think that's an awesome feature.
Yeah. And what it reminded me of when I was learning about it was kind of, I don't know if, Great Clips. I don't know if you've looked at Great Clips anytime lately, but they moved from having where you just walk, their last thing was like walk in anytime or come in anytime, to now it's use our app and schedule your time for your to get your hair cut, and then just show up at that time. And it really made the experience better for, I think, everyone that went to Great Clips, because now you don't have to wonder how long you're going to wait. You don't have to,
Yep.
it's going to time save it. You can see, hey, this Great Clips has 10-minute wait, but this other one has a 20-minute wait. Okay, well, I'll drive 5 minutes longer just to get in quicker. And I think this is starting, the teledentistry in general is starting to add up to allow for these apps that you can white label to really be able to be like, okay, I can either go and to this orthodontist that, okay, I don't know what's going to happen. I don't really understand, what my experience is going to be like. Or I saw my friend and she's actually able to see what her experience is like constantly. And, and I'm going to go, I mean, this is just a thought process, but it's, as things get better and better at teledentistry, people are going to want to go with what they can understand better, and they realize it's going to make things a little bit more efficient for them.
Absolutely. And again, it's amazing how each one of these little things that we're discovering positively impacts your workflow. For example, to use, the Great Clips model.
Yeah.
It's Friday afternoon and our office is closed, or Saturday morning, and a patient can send in a simple IM. We can tell them when to come in, and that eliminates phone calls on our regular work days, and scheduling their appointment. And I know what it's like to be a patient. I'll get a reminder from my physician or my kid's dentist that says it's time for an appointment, and I set it on my desk under my paperweight and wait 2 weeks to call, and then I wait 2 weeks more, and then what is it? What's that inertia we're trying to overcome? And this app has done that. If I could have just sat down, if I'd gotten a message on my phone, hey, it's time to schedule your physical or whatever, and I pop it open and schedule the appointment, boom, it's not only is it done and that patient is coming in at the appropriate time for the appropriate treatment, it doesn't burden the rest of your staff for a normal non-teledentistry patient scheduling. And so it's amazing the little things that it does that we did design into it, but I think that the profound impact that it's had in so many different areas of the patient, staff, and doctor process that have been positive or unexpected are really cool to see as a developer and working with the app.
Yeah, no, that's a good point, because with software, it's one of those things you really learn what works well and you double down on that. And so it's interesting to see what you found and what you found works well, and really where it's kind of leading you. And so I guess, yeah, with teledentistry and with the Lineflow, I see that you also have the ability to kind of educate the patient as well. From when I was kind of going through it, they already have, I guess you guys already have documents put into the software itself over like Invisalign or maybe other types of clear liners and other products. And then as a person, as you bring in a patient and you set them up with what they're going to do, it will automatically send out the education to them. Is that,
That is correct. And that's another thing that surprised me. So before teledentistry, we would see the patient at the start of actual tooth movement, and we would, put on attachments, do any IPR that we needed to, and deliver the aligners. And then the clinical assistant would go over instructions. And, each clinical staff member, even though there was information I wanted them to give to all patients, I couldn't script all of them exactly the same. So they were getting different messages, and maybe some things could have gotten left out. Or what always happens is after a long appointment, a patient is like mentally like checked out. They're like, can I go now? And so they're not really listening to the instructions. And then you give it to them on a piece of paper too, and they fold it and put it on their desk. And since they haven't had to interact with that for 5 weeks, they throw it away. And then all of a sudden they need some instruction or some information. Their aligner's cracked, or, oh my gosh, I forgot how to clean this, or whatever. And all that information is self-populated on the app when you start treatment. You really just need 4 simple bits of information to set a patient up on the app. So now, instead of explaining instructions to the patient, we call it setting them up on the app, and they just go to the app store, click on our white label app, download it, and then we show them there's just 5 buttons that they use on their app, and one of them is patient information and instructions. So when they click on that tab, that's populated from my template. And let's say they're using Invisalign aligners. I have put in patient information off the Invisalign website as PDFs and videos that they can access to see how to care for their aligners and what the normal aligner experience is like. And that way, all my assistants are giving the exact same information to all patients, and it's really made our messaging super consistent. All they say is, here's your information. You'll need to access this throughout treatment. You can see here, this is, how to care for aligners. And if they're using 3M Clarity aligners or some other product, all you do is put in the patient's first name, last name, email, and the type of treatment that you're using. And at Lineflow, we set up those treatment templates for you. And some of the treatments, I don't necessarily like the PDF files, or I want them to do something differently. We can type in our own instructions, and that gets uploaded. So any instructions that you want, that you already have in office or whatnot, or that you want to copy links from a website, go right into that messaging section and are accessed 24/7 by the patient with a consistent message from your office.
I gotcha. Yeah, that makes sense to me. And that's kind of finding with cloud dental software and just the different uses of it, including Teledenistry, is that no longer do you have to almost, go through a lot of training to get someone that works for you to do exactly what you want. You kind of do the simple task of signing up for something, and then the software itself performs the rest of it. So you really just teach somebody, hey, this is how you sign somebody up with an app, which most people can do pretty easily.
Oh,
and
yeah.
The app is kind of like, hey, let's do the hard, the hard work for you. And we can automatically notify the patient. We can kind of keep tabs on them, and we kind of validate everything that is occurring for you.
Absolutely. And that's another profound impact to your workflow, because some assistants are more experienced than others. And even with a fully staffed office with experienced assistants, your messaging is going to be all over the place, because you can tell in meeting after meeting and morning huddle after morning huddle, this is the messaging we want to get to patients.
Right.
Well, when you tell that to your app, that's exactly what the patient gets.
Right.
So they're getting your messaging, and in a much, much easier and digestible way that's also accessible indefinitely. So yeah, that's a cool feature of the app for sure.
Yeah, that makes sense to me. And so I guess another thing is, I'm interested in what I guess information do you take from the patients why they have their aligners, I guess, what information do they input into the app when they're away, such as photos and stuff like that?
So we tell people it's super easy, and it is. You have to take 3 pictures at each aligner change, whatever that frequency is. I'll just use 14 days because that's, what has traditionally been used by a lot of aligners. But the app, like I said, is set up whatever your protocol is. And in our office, it's different for different patients based on their tooth movement. We might have people changing 7 days, 10 days, 14 days, 21 days. It doesn't matter. You just put it in there, and you can update that on the fly too as you go along if treatment changes. But they have to take 3 pictures every 14 days. Super easy, takes less than 5 minutes. And then periodically they will answer questions. And like I said, we're constantly improving and updating the app. We found out through a lot of patient and doctor feedback initially that we were asking a set of 4 questions and they were the same. And there's a term called gamification for software where you know, I don't know if you're familiar with Duolingo, if you've ever used that to try and learn
I've not
language.
But I was just about to bring up gamification, so it's funny you said that.
Yeah, oh, perfect. So we've tried to randomize the questions and also throw in some questions like, you know, do you have a pet, you know, or Coke or Pepsi, cat or dog, you know, stuff like that. So, and to alter the frequency, all of which you can do really easily with the app. Sometimes, you know, it might ask a question 3 days in a row, and other times it might go 4 days before. And so by alternating and randomizing the interaction of those questions, it makes it way more fun, engaging for the patient, and we get much better feedback from the patients. So we've stopped asking the same questions, but the basic information we want to know is, it's again replicating what I've done since 1999 when I started with aligner treatment. When a patient would come in, I want to see how their old aligner that they've exhausted fits in their mouth, and then I try in the new one and I want to see that. I also want to look at their teeth and occlusion without the aligners in. And that's what the 3 pictures do. One is taken with the aligner they've exhausted, one is taken with nothing in, and one is taken with the new aligners in. And I can compare the fit of the 2 and see if any teeth are not tracking. And then also at those patients, you know, before teledentistry, I would want to know how they were feeling generally. Like, what's your how are you? How am I doing? How are you doing? But then more specifically, you know, how does your bite feel? Are you in a weird place, or is it starting to come together? And then how do you feel about how your teeth look? Are they looking better than 12 weeks ago, than 24 weeks ago? So those are the types of questions we ask. How do you think treatment's going? How mouth feel? How's it feel in there? And then aesthetics. Are we trending in the right direction? If not, we need to communicate with the patient as to why that is. You know, we're in transition, got to look a little worse before we look better. We're opening space to move this tooth into it. Or, yeah, you are looking better. I can see that, you can see that, and you're feeling good. So basically, we just want some good visual input and some good feedback from the patients. And now in a randomized format and gamification with those questions, we're getting more and more of that, and getting the information that I historically got in office talking to the patient. And so now, when that patient does come into the office, let's say it's for a case refinement or a rescan, I'm able to talk to the patient about things that are important in their life, or how, you know, it's not all totally tooth focused. Because I've got that information. They've got that information. They know I know it. We don't have to spend 20 minutes. Well, you know, why is this tooth, you know, a little wonky? We can talk about what's happening in their lives. And that's how orthodontic appointments have traditionally been. And what makes orthodontic treatment fun is you see these patients and find out what's going on in their lives, and just do your work without a lot of cluttered back and forth communication that I used to experience in an in-office aligner patient, just to get me and the patient on the same page with how their treatment is going. They walk into the office and we're on the same page before their first foot comes in the door. Mm-hmm. And they know that, and I know that, and that's an amazing amount of reassurance for a patient going through a complex process.
It's interesting because with with traditional orthodontics before Invisalign, you had braces, and you didn't have to worry about if they're going to wear their liners or anything. And then with the clear liners coming out, realize, oh, this is, patients want the clear liner, right? But then it kind of brought up a whole new set of problems with, now you have to trust the patient to wear the aligners. And I think once we, some direct to consumers came in and said, oh, well, we don't even, we don't even have to do the visit, with clear aligners now. And then I think dentistry as a whole is kind of realizing, well, skipping the whole, dentist, regular orthodontist, visit or, person in between is not really probably the best answer, but using technology to improve how orthodontics is done. Now that sounds like a pretty good answer, and I think with, no longer is it going to be so much of like, you give clear aligners out to your patient and you just trust. Now it's, you trust, but you verify, constantly. And now you can, instead of just like treating every patient in a straight line and every once in a while, oh, now you change it, you can kind of change the patient, and just guide constantly. And it's going to be a process that's specific to their teeth and their health, that's going to make sure it's kind of the best for them, versus just kind of like, we'll just zigzag when we have to and hope for the best. It's okay, now we're going to get to the best treatment, in a linear, or in a nice flow, like I guess a line flow, right? So
yeah, hey, there you go.
So
I think that's awesome. And another thing, that the do-it-yourself aligners that came out did expose a huge market. I think as dentists, we were surprised that would work. I think that's why non-dentists developed that.
Right.
But there's a demand out there for it. And our profession, was threatened in some way. And as we were developing the app, one of the things that was very important to me is to protect the patient-doctor experience, not just from a personal level, but, my father is a dentist, my son is a dentist, my daughter-in-law is a dentist, I'm a dentist. This app was designed, by an orthodontist for orthodontic treatment. And we can do it better. We're the ones that should be doing it. And patients also want that component. The only thing I've been able to see that the do-it-yourself aligners, the only way that appeals to patients is some price and some just the convenience. So when we can offer the convenience and actually treat patients better and enhance the doctor-patient relationship, we're helping the profession. And I think the future's bright, or, I wouldn't have encouraged my kids to get into it. And I think we need to focus on technology moving forward and make sure we're the innovators and make sure we have the patient's best interest at heart along with the professions.
Yeah. And I think a way to, kind of how we got so blindsided by direct to consumer stuff was that dentists are so focused on the patient's well-being and making sure they're getting the best, possible treatment that they can get. Where I think a lot of, people in technology, they think about what do people want and they start there.
Yes.
And dentists don't start there. They start at, how do we incrementally get people better? And
yes.
So I think, so now we have two different places, right? We have the people that, they don't really understand the treatment anyway, so they're just going to give people what they want. And then we have the dentists who are like, let's only move a millimeter, and, technology, we don't need technology. We're just focused on patient. And now it's kind of, everything's coming together, I think slowly but surely, is that like, oh, we can use technology and get a better, treatment for the patient. And I think that's why the future is so bright for dentistry. And obviously, I'm pretty obsessed with dental technology. So obviously technology, for dentistry as well. And I think that's where we're being taken. And I think that's, positive for everyone.
I love the way you put that. I've never heard that articulated that way, and I love it. I'm going to steal that, actually.
Yeah, go ahead.
The fact that, technology companies, or even just, for example, do-it-yourself aligners, what I heard you say is they were completely starting and focused on the point, what do patients want? And dentists were not and will not, because that's never been number one on our list, because many times patients will come in wanting something that is going to deteriorate their health rather than enhance it. And technology now, because we've got these two camps, if we never had those two camps being successful, I don't think dentistry would have been the people or the field that's bridging that. And now with dentists like you and other technology companies coming together, we're bridging that gap and doing both, giving patients what they want and still delivering the highest quality treatment that we can and enhancing their experience and their dental health.
Yeah.
But I love that. I didn't realize actually what was motivating, people and industries to arrive at their specific points to what we have now.
Yeah. Yeah, it's kind of one of those things. I started this whole channel because I was kind of just annoyed by the fact of how hard it was to find information out about dental technology. And I was like, why does it need to be difficult? You know what I mean? Like if dentistry is going to improve for the future, it can't be difficult for dentists to dentists should not have to pay consultants to find out technology, True. And that's it's kind of where the dentistry still is, because, we're still like advancing as technology wise, but it's all word of mouth, and now it's slowly becoming, I think, more important. But we see the larger DSOs, jumping on everything first because, their problems scale, where individual dentists, their problems don't scale. They just kind of look in the mirror when something goes wrong, where DSOs kind of go like, okay, we have a huge problem, right? So, I think that's why we see DSOs, implementing technology quicker. But I think as things become cloud and, as we, what would I say, continue to kind of make information easier to get on technology. And we're starting to realize that, it's not only just the future, it's like, it's better. And I always like to say dentistry and technology is 20 years behind. Maybe now it's 15 or 10, everything ramps up with technology. So, as it's, one day it's 20 years behind, the next day it's, 10 years ahead. So, it's one, I don't know. I just see it as one of those things that we're going to cross that barrier where every single dentist is going to go, okay, what technology do I need right now? Like what do I need? Not kind of like, should I? Right now it's kind of like, people are kind of pressing in like, oh, I don't want to update because then I have to like teach everybody and I have to train, and training's the biggest, the pain that everyone gets to. And I think with cloud software and how things are becoming automated, it's just it's going to be the point where training is it's going to be simplified, and it's going to be the least problem that, it's just going to be like, okay, this is what we have to do to get better patient education and, better treatment. So.
Yeah. And it is, I think we can all agree it is better treatment.
Yeah.
That was one of the things when I started in dentistry, we didn't have CERAC, we didn't have Invisalign. We didn't have, I think SureSmile was available. That was one of the first, digitally planned treatments where you could design with computer aided technology and come up with a very precise finished product, which kind of amazed me at that time. I remember sitting at a CE course for SureSmile back in the 90s, and I was thinking of all the things in my home that were designed with computer aided design, from a plastic trash can to a vacuum cleaner to the cups in my pantry. And I was like, and we're not doing this for dentistry. We're not, why are we not? And there are many reasons why we weren't. But now from where I sit, I think, just they're the amazing things that you can do with computer aided design, from individual teeth with CEREC to, products like that, to aligners and everything else. We're able to control where the teeth will be at the end of treatment, rather than just nudging them at each appointment towards a vague direction that we haven't outlined and planned. And so it's cool at this stage in my career to not be that guy sitting in that SureSmile meeting going, why are we not doing this? And of all things that are important, my plastic trash can and the dimensions of it are not as important as, a good crown on tooth number 30. You know what I mean? And it's coming. Not only is it here, more is coming, and it is getting easier to train. So you can't, but that inertia is a real thing. I know what it's like. In our own offices, we've got enough stuff just to get through tomorrow. Do I really want to implement a new technology? And companies are making those easier and easier and easier. And I found the transition to be quite easy.
Yeah.
It's still work, and you have to invest in your staff and motivate your staff, and articulate why it's important that we're doing this. But once they understand the importance of it and see what it can do, they come on board really quickly, and it just is seamlessly part of your treatment. And you wake up 6 weeks into it and you're like, why didn't I do this sooner? That's the way it's been with every technology, whether it was a scanner or whatever. I'm like, gosh, why didn't I buy a scanner 10 years ago?
Yeah.
So yeah, it's a great time to be a dentist.
Yeah, no, I agree. Yeah, that's awesome. Yeah, it's one of those things. It's just like, and that's the fact that you are the co-founder and you're kind of developing the software. Just kind of shows the change that you want to see, and that you're kind of implementing it, right? You're not just kind of like, oh, we need this. No, you're like, no, we're going to do this, and we're going to help dentistry as a whole, and really just I always think like, how can you affect the broad amount of people as much as possible? How can you help the most amount of people? And I think with cloud software, it's a good way to be able to help dentistry, be able to help so you got to think each dentist that you bring on to your software, you're going to be able to help all of their patients, right? You're being able to help them. So the more patients, the more dentists that use your software, the more people you're helping. And I think that's one of the cool things about technology, is that okay, yes, technology is cool, but it allows you to kind of make things better. And you can do so at scale, where a lot of, you just can't do in a single dental practice. You can start more dental practices, but that doesn't change maybe other people's ability. That just changes, your ability to, be a little bit more specific for what you want. And so I think that's one of the cool things about technology, and about, what you're doing at a Lineflow, and what how dentistry is just kind of improving, as we go. So yeah, where can people learn more about a Lineflow, or anything else that I haven't added?
You can call or email me, Hoffman Orthodontics in the Kansas City metro area. If you want to just send me a message or call me, I love talking to dentists from all across the country. So never hesitate to call me. Also, check out alineflow.com. And poke around on the website. It's got lots of different features and explains a lot more about the platform and how the patients interact with it and the doctors. And you can also schedule a demo on the site. And we can walk you through a little virtual meeting on how it works and show you how it might work with your treatment flow in your office and what type of treatments you might want to use it with. But it's so versatile, you can use it with any type of procedure you want to monitor remotely, not just orthodontics.
Right. Yeah. And I actually, when I was reading about other teledentistry, and it was just a generalization, they talked about how some oral surgeons are monitoring stuff that they do, such as maybe even wisdom teeth after they, extracted them and, see how the patient's doing. I was like, oh, that's an interesting aspect. I could see, a Lineflow could easily, implement that. And, you could just kind of, any big procedures you could follow and make sure that since you can customize on Lineflow to kind of like what you want it to be or what you want it to monitor and everything. I was like,
yes.
Yeah, that's an interesting aspect that I, wasn't really thinking about originally. So.
And then another thing that was one of our goals, but again exceeded my expectations, is the way that it enhances productivity while you are reducing the amount of hours worked. And so time and money are our two most valuable resources. Time, number one, because you can't make any more of it, and money, number two, because it's hard to make more of it. But this has increased our production quite a bit. And we were running a capacity in 1999 to where, we just didn't have an opening if you called that day. And we were working 4 days a week, seeing patients 8 to 4. Now we're down to 3 days a week. Our numbers are way up, and our staff is less stressed. I'm less stressed, and our patients can see and feel that when they walk in. We've got time to do those things that makes us better dentists, better assistants, better family members. We're not just running it redline like I was before, while we're still seeing and treating more patients each and every year. And that's by eliminating a lot of the appointments that are unnecessary for an in-office visit. Like we finish about 300 patients a year. And when I started back in 1994, me and my dad were working together, and we'd see the patient at 6 weeks for a retainer check, then 3 months, then 6 months, then yearly. That's kind of old school, obviously. But now we just do all that with the app. The patient gets a message and say, hey, Dr. Hoffman wants to know how your retainers are doing. They take a few pictures. And none of those 300 people that finish braces at Hoffman Orthodontics annually are returning to the office until we need them to do something productive, like replace a retainer or look at a tooth that we think might be moving that, they showed us through the app. Because a patient that doesn't have a problem on a retainer visit is just taking up space in your chair. And it's the same way with an aligner patient. If they come in and all you're doing is looking at how this aligner fits and giving them their next series of aligners and everything's fine, how do you answer the question from the patient? Now, why did I miss work and come in today? And, well, there isn't a good answer.
Right.
Because I wanted to see it and I don't have any other way. Now you do have another way to see it. And it's amazing how it will just blow holes wide open in your schedule to do more productive things or just to be sane and answer those emails,
Yeah.
We all know how they stack up during a busy day. Well, they're not stacking up on me anymore. And that's been it's awesome.
Right. Yeah. And I think that goes to the effect of, technology is, it's right now we have to explain ourselves, right? Like we have to explain why this technology works. But like we talked about before, it's kind of what everybody wants, it's just not the way things are right now, so
Yes.
when you're changing things, you kind of have to explain it. But once you use something and you realize like, oh, I only do what I want to do now. And if that's how everybody is feeling, then it's great, right? And so if the patient doesn't want to come in because you're not really doing anything other than looking at them, they don't have to now. And they're gonna be like, oh, I like this. If you get to, spend less time doing things you don't want to do, such as seeing patients that, you're not altering and that you could have done from another place, now you're going to be happy, and so, and you're going to have time to do more what you want to do. And just, it's going to make you do what you want to do and allow the patients to be happy. And on top of everything, to get better treatment out of it is kind of like the all around the best way to do things if that's, where we're going. So yeah.
Absolutely. So check out lineflow.com. It'll answer most of your questions. And I truly feel that since this app has been designed, by orthodontists for orthodontic treatment, with patient care as the main priority and quality treatment results, nobody can beat our platform for all the features that it has and the ease of use, as well as no one can beat the price either. The monthly fees for some dental monitoring software is very expensive. We have entry levels where you can monitor up to 50 patients, or I'm not sure the exact numbers, but it's less than $200. It's around $150 a month to use our software and see what it's about. So it's not a big risk to you, and it's not going to take away from your cash flow. We want to enhance doctors' cash flow and increase the number of patients they can access and treat in a quality way. Yeah,
well, thanks, Kurt, for coming on here. I enjoyed learning more about Lineflow. I enjoyed looking at it, and I'm just glad that there's companies that are out there like yours that are pushing the needle. So I appreciate it.
Awesome. Well, it's been super fun, and I've enjoyed the podcast too. And hopefully, I'll be back soon with some new technology. We'll see.
Yeah, it sounds good. All right.
Take care, Aaron. Thanks for your time. I really appreciate it.